Lewis, here's your pain medications. The doctors increased your NSAID order because of your pain. I know you've been dehydrated and your stomach hurts, but this should make it better. And I'm just doing it because the doctor said so.
Okay.
Cool.
How's Lewis doing?
He's in a lot of pain. His stomach is swollen. He doesn't have any bowel sounds. And he has cold sweats, you can see that. And he hasn't improved. I think it was the constipation from the narcotics. But I give him more of the NSAID that you had prescribed from earlier.
Alright, so let's just keep monitoring him. Hopefully the pills make him feel better.
Okay, we'll hope it works. Whatever. So after I assessed the patient, I figured that I should have been more careful. I should have advocated for my patient more because he had, I should have been more careful. He had severe abdominal pain, a lot of abdominal distension. He had no bowel sounds, but they were not from constipation. And I should have questioned the narcotic more instead of just prescribing more, hoping for the best.
And here to say, in Norway, also my responsibility as a child person is for them to support me with questions and stuff like that. So instead of me just going in there and saying I'm monitoring and not doing anything, I should have got to the physician. Follow the next medication. Very important.
This case shows multiple breakdowns, lack of familiarity with medication risk, unsafe and reliance, outdated orders. Failure to escalate to the physician and poor communication. Our system must support incident reporting, encourage a just culture, and providing ongoing education to reduce the risk factors.
The facility shares responsibility. We must ensure daily provider rounds after surgery, better nurse to patient ratios, and ongoing education about high risk medication like NSAID. We need policies that support rapid escalation and protect staffs who advocate for patients.
A nurse is accountable for safe practice and patient advocacy. However, the facility and providers also share responsibility. The board's role is to uphold professional standards, investigate serious errors, and ensure nurses are competent and supported to speak up when something is unsafe. The priority is always patient safety.
There are multiple risk factors that can contribute to a medication administration error, such as if a nurse, as an example from the portrayal that we had done earlier, was that the nurse was not, had some compassion fatigue. They were very tired after their shift was over, so that compassion fatigue resulted in carelessness, in addition to stress from the nurse, inexperience if they were just newly on that floor and they were brought over from a different unit, or just overall lack of experience of what that drug can do, what it means to administer somebody that drug, especially a high dose like that at a young age.
As a charge nurse, I know that when a medication error occurs, there's a clear procedure that we all must follow. First, we assess the patient immediately to determine the condition. Then we notify the provider right away and follow any new orders that are given by them to help stabilize the patient. We must also complete an incident report, which is different and separate from the chart, and continue to monitor the patient from any adverse reactions. Finally, it's important that we participate in a root cause analysis to understand what went wrong and how we can prevent this mistake in the future. I also recognize that the facility has a responsibility as well. It's not just about the individual nurse. The organization must provide adequate education and training on high-risk medications and create a culture of safety where nurses feel supported to speak up and question unsafe orders. That culture comes from leadership, and as a charge nurse, it's my role to model it and reinforce it.
Something doesn't seem right.
We must act.
Careful assessment, communication, and the courage to question unsafe orders save lives.
Medication safety is a shared responsibility, and together we can prevent tragedy like Lewis's.